Hello, and welcome to Breaking the Silence, a podcast series produced by Angels Protection, Inc., and I'm your founder and chairwoman. And this is where we bring forward the voices of young mothers, researchers, and advocates working to dismantle health inequities across healthcare systems. I'm your host, Makaila Davis, and I'm also a 2025 to 2026 visiting scholar at the Health Policy Media Fellowship with the George Washington University School of Nursing. This podcast series is a part of our ongoing mission to center the lived experiences and systematic challenges faced by Black, Indigenous, and people of color communities, adolescent mothers, especially when it comes to maternal mental health, reproductive health, and suicide prevention. And I just want to really understand and put the focus on that today in episode 2, we shift our focus upstream to research, biology, and future facing science that could help us prevent harm before it starts. So I want to do a special introduction for our guest, Kobe Abney. And today she is someone who represents the future of reproductive health equity in science. Kobe is a fifth-year pharmacology PhD candidate at the University of Pennsylvania, conducting groundbreaking research at the intersection of pregnancy, racial health disparities, and biotechnology, which is really critical to the work that she's doing. She's working under Dr. Rebecca Simmons at the Center of Women's Health and Reproductive Medicine. Her dissertation is focused on characterizing first-trimester plasma derived from extracellular vesicles, the Black from Black women as a potential tool to assess placenta dysfunction and predict adverse pregnancy outcomes. So I really want us all to let that sink in. She's doing amazing, incredible, groundbreaking research work. So she is pushing through boundaries of science to better understand pregnancy risk in Black women at the biological level, and with it, the possibility of early detection, intervention, and life-saving change. Her research is funded by the March of Dimes Research Center at Penn, and her commitment goes far beyond the lab. She's passionate about representation in all areas of research, in the subject matter, in the researchers themselves, and in how information reaches the communities. So she's also a proud graduate at Spelman College with her Bachelor's of Science in Biochemistry and a 2026 PhD on the horizon. Her work is already garnered in the recognition. She's a 2025 March Times Emerging Leader Awardee, a 2025 Research Trainee Affairs Fellow, and a 2024 HHMI Gilliam Fellowship finalist, just to name a few. She is well credentialed and awarded. But what stands out the most is her heart. She's deeply committed to mentorship, outreach, and early exposure for underrepresented students in science. She's ensuring that the next generation doesn't just inherit the work, but actively shapes it. So today, I really want to touch on why this conversation matters critically. When we talk about suicide risk and mental health in young BIPOC mothers, we must also talk about the science, the environments that's growing life in, the systems that fail to screen early enough, and then also the deep racial inequities in maternal outcomes. So today's conversation is about hope and science as a tool for liberation. It's about how representation in the lab can transform results in the clinic, how investing in young scientists like Kobe can save lives, and how science, when done right, can be a language of healing. So now I also want to touch on, for us to begin, whether you are a student, a healthcare provider, a policymaker, or a parent, I invite you to listen closely. This episode is not just about research, it's about reclaiming reproductive health for communities who often, too often, have been excluded from both the data and decision-making process. So let's get into this powerful conversation with Kobe. And as we talk about the amazing work and groundbreaking research that she's doing that's helping shape and form the betterment of our future legacies to come. So if you would like to introduce yourself a little bit.
Yes, thank you for that warm introduction, Michaela. I'm really excited to be here. I've, as a fifth year PhD student, I've discovered that women's health and reproductive medicine, specifically Black maternal health, has become my calling, if we want to say. I actually was introduced into women's health and Black maternal health as a research option when I did a summer internship here at Penn during my time at Spelman, which really introduced me into what it means to do women's health research, which is something that I never, I had no idea about. Um, and in addition, also just I take a lot of pride in being a Black woman in this space, especially for first generation college students such as myself growing up. I had no clue what a PhD was or like even like how to pursue that. And so I was very grateful at Spelman to have been surrounded by Black women who had their PhDs and who were in the research field. And so I quickly learned that that's what I wanted to do. And like I said, I pursued a research experience at Penn where I learned about women's health. And that was the reason why I decided to come to Penn, because of the research that my lab specifically was doing, but also because we have this entire center for women's health and reproductive medicine, that would be available to me. So yeah, I'm really excited for this podcast. In addition to research, I really enjoy outreach and mentorship. I've had many students during my time here at Penn, many of which I can happily say have been Black girls. And so, yeah, just paying it forward is definitely a part of my journey and a part of my story. So I'm happy to share.
No, thank you so much for that. And it's a blessing to have you in this space because you are needed. So I just feel really blessed to be in this moment now here and being able to do this podcast and share you be able to share your wisdom.
Yeah.
So going right into what you touched on a lot too already, but to focus on like your dissertation, so it focuses on extracellular vessels in the first trimester among Black women. So for listeners who may not be familiar in this particular area of science, could you explain what that means and why it's so important for early detection in pregnancy?
Yeah. So I know this is like a very niche field, so I'll try to break it down as as easy as I can. But I like to give the analogy of like mail and sending mail to someone. So if you think about yourself, you write a letter with information in it, you package it up into your envelope, you send it off to UPS, FedEx, all those postal services. Then your recipient, that has you have directions on your mail, goes to a specific person. That person then opens your mail, reads it, and then internalizes whatever you've written, right? And so if you think about extracellular vesicles or EVs, I'll just use EVs now. If you think of EVs as messengers, all of our cells release EVs as a form of communication between cells, right? So you have one cell that'll package specific material. If you think about like proteins and RNAs and DNAs, they package some of those materials into the EVs, release them into the circulation to then traffic to recipient cells. And then those recipient cells can read that information and then make the changes necessary, right? And so this happens during just normal processes. It's happening right now in our own bodies, just as a form of communication, right? And so in pregnancy, we found that EVs have support normal processes during pregnancy. So it's been shown to support implantation. It's been shown to support the developing fetus, as well as it's been shown to support healthy labor. And so, in situations where you have a disease or a complication, and in pregnancy, such as like preterm birth or preeclampsia and fetal growth restriction, all of which affect Black women at a disproportionate rate, 3 to 4 times more than white women. The EVs actually can change what they're packaged with, to maybe alter and maybe alter the cell that is receiving those EVs and then change the function of that cell. And so it's important for early detection in pregnancy because the earlier we detect these complications, such as preterm birth and preeclampsia, the better our interventions can be for on the clinical side, and the more favorable maternal outcomes and fetal outcomes we'll have. And so we use EVs, or we hope to use EVs. This is what I'm researching now. If the material in our EVs can predict early on in pregnancy if a woman would go on to have, say, preterm birth or say preeclampsia or fetal growth restriction. So if you just think about it generally, say in my EVs of Black women who have preterm birth, say that there is a specific protein, right, that shows up in the women who have preterm birth versus the women who have normal pregnancy. And that is what we call a biomarker. And so EVs are really easy to obtain in the clinic. You just draw your blood. We do some things in the lab to assess that protein of interest, and then we correlate it to pregnancy outcomes. And so, yeah, that's the gist of my EV work. Not to get into the nitty gritty, but yeah, it's really important to detect it early on in pregnancy, like I said, to improve outcomes, not as a therapeutic, but really for an intervention early on, because unfortunately now there are no clinical tools to predict preterm birth or preeclampsia. Um, you just present symptoms in the clinic, and then they diagnose you when it happens, and sometimes that's far too late, to do anything about it, which leads to the adverse outcomes.
No, this is amazing. So, and I'm glad that you really touched on why it's so important early on for us to do this, because if we're acknowledging that, then we can do a lot of great interventions to prevent it.
Exactly,
Uh,
exactly.
so, amazing work, and
Thank you.
it's really necessary. Um, and that kind of like ties into also as well our next question of as a Black woman in science researching Black maternal health, how has your identity shaped your research questions and approach? And what perspective do you bring to the lab that are often missing in traditional research spaces?
Yeah, I love this question. Um, so one of the main questions I get when I tell people I do this type of research and I'm trying to understand the Black maternal health crisis, they ask me, well, it's not because they're Black, right? So what is it, right? And so we know that race is not biological. We know that race is a social construct. And so it has no biological relevance. But what does have biological relevance is our lived experience as Black women in America. And if you even look at the global health outcomes and health disparities, when you compare the US to other developed countries, the US has some of the worst maternal health outcomes, and that is even increased for Black women. And this experience is very unique to Black American women. I want to make sure I say that because they've actually shown that Black immigrant women have better outcomes than Black American women. And so when we think about, okay, if they're both Black women, having some of the same lived experience, what else is underlying um, that causes Black American women specifically to have this disparity? And the short answer is just racism. Um, Racism and discrimination gets under the skin for sure. And me being a Black woman coming into this research space, I can bring that perspective because I think for people who don't have this lived experience, it's hard to conceptualize how stressful racism is, how stressful discrimination is. Like, these are things that we are taught to just live with at a very young age. And like I said, it's a very specific and unique lived experience of stress. And so, me being a Black woman, being able to articulate it in that way um, really helps people again conceptualize, okay, we know that race isn't biological, so what else is driving this outcome? And so just having that perspective and being able to um, articulate it in a science way and in a way that makes sense to scientists, I think has made my research really um, I would say palatable to others who have this lived experience, because it's been many of times I've actually presented my research outside of the US, and trying to explain this definitely took some some time to break down what it actually means to be a Black American woman, and how that lived experience um, how that lived experience has afforded this disparity, unfortunately.
No, definitely. And I also think too, like as a Black woman, our perspectives are diverse.
Yes,
Because all of us, we've been through many different scenarios and situations. And that's what, shapes us to do this great work within the community and to keep going
absolutely.
to it consistently. Um, so then, also for us to be talking about representation in the three dimensions, the research itself, the researchers, and who communicates the findings in the research. Are you able to break down for us why that three-part model is critical for reproductive health equity?
Yeah. So I came up with this model because I feel like research transcends what we only do in the lab, right? It's because if I am the one doing the research in the lab and I, make these wonderful discoveries, if we don't have people to communicate that to the correct communities or, in a culturally competent way, that research unfortunately is not going to be as impactful. And so with this three model approach, I focus on the research again itself. So what type of research do we do? So what that means is, historically Black women and Black people in general and people of color have been excluded from research studies. And so the data that we do have on these diseases, on these symptoms, they're largely based in white males. And as we know, we are different than white males. Just as simple as I'm just going to use eczema for an example. If you Google eczema, you'll see on white skin, it's very red, it's very inflamed, but on black skin, it doesn't look the same. And so it's really important to be diverse in our research because although race is not biological, you have to think about all of the other factors that impact health, which is not just an individual factor. You have to think about the living environment of that person. You have to think about their social environment. You have to think about the policies that affect their community, which affect the types of food they can eat. It's a very layered approach. And so it's very important to be diverse in the research so that we can understand how these diseases and these complications um, affect and show up in different populations. And then the next level is the researchers. And so I can use myself as an example. Again, just with Black maternal health, I wouldn't say it comes natural to someone who doesn't experience racism and discrimination on a daily basis. Um, you can experience discrimination, but especially being a Black woman, not only facing racial discrimination, but also gender discrimination is a very unique lived experience. And so I think it's important for Black women and just people of color to be in the research spaces as well, because we bring that lived experience, which helps tailor our specific research questions. So instead of trying to understand if race is biological, we bring the perspective of, let's think of it from a social aspect, from a social public health aspect. And then the last part, who communicates the findings, right? And so I think this is very important, especially for physicians and nurses, people who are in the clinic interacting with different communities, people coming in from different areas, speaking different languages. It's really important to be culturally competent. And it's not enough to um, just give someone a diagnosis or just explain in medical terms what's going on, because not everyone can understand that and conceptualize what's being said. And so it's really important to not only have diversity in the research, in the researchers, but also people who know how to speak the language of the communities that they're serving. And so that's really how I pieced together that three model, three-part model approach for health equity.
No, that's amazing that you touched on cultural competency, because I also feel like it's so important that we, um, as researchers, do the work that we do, and provide and go into as many spaces as we can into the
Mm-hmm.
clinics with the doctors, with the nurses, working collaboratively with them because they don't know what they don't know.
Mm-hmm.
There's a lot of different underlying biases that is happening when they're working with patients on a day-to-day basis.
Yeah.
And there's a lot
Yeah.
of lack of support that they don't have as well too. So I'm really grateful that you brought up that point. Um, and also too, I want to touch on so you're a March of Dimes Emerging Leader awardee, and then you're also an advocate for outreach and mentorship. Um, what are some of the most powerful ways institutions can truly support underrepresented students in STEM beyond surface level diversity efforts?
Yeah, this is a great question. This is definitely something that I think about often when I um, am involved in these outreach programs. Like, it's not just enough to just have some Black students come to the lab, but really just like immersing them into all of the different perspectives of science and healthcare. And so, yeah, I think in a full immersive experience. So, for example, we have I was a part of like the inaugural team who has created something at Penn called Deep in STEM, which is a weekend of like a full immersive weekend where we bring in students of color from marginalized backgrounds um, to come to Penn to not only well, we have representation from many different schools here at Penn. So we have representation at Penn Medicine, Penn Nursing, Penn Dental, the engineering school, things like that, to really give students an opportunity to see the broad options that are available. I think is really important for early exposure. Because like I said, growing up, I knew I was interested in science and medicine, but I had no idea what was beyond just being a physician, right? Or being a nurse. And so really just early exposure, I think that's key. And having people like myself I often speak with high school students um, and undergrad students as well. But I think the earlier you go and the earlier you give those students exposure, the more the more options they feel like are available to them, especially from people who look like them. So I definitely make it a point to speak to Black girls in high school to really show them like you can do other things besides just being a physician. And then just also outside of like that, like public health and epidemiology is another amazing route to get into this type of work. And so yeah, I think just having fully immersive experiences for students young early on, I think makes all the difference.
No, definitely. And that's great that you were part of that inaugural team, pushing forward in that effort. Because it's really important that we start early for the children because that's the trajectory in which way they will go.
Mm-hmm.
So, and making sure that we are upholding a great legacy for the work that we're doing. Because what we don't want to do is do all this great maternal health equity work and we're not passing the baton.
Exactly.
So, that mentorship is critical. Um, and when you're mentoring, like, pouring as much as you can. And like you said, like there's a lot of things that, because I'm also a current PhD student too, that
Nice.
we were not taught, like fellowship programs.
Yeah.
And,
Yeah.
going after that or going after grants to support the research that you're doing. So
Exactly.
there's a lot of different, like key different words that you learn, like fellowship, grant, accelerate.
Mm-hmm.
Um,
Mm-hmm.
so, um,
And even just to that point, even knowing that you can go to school and get a PhD for free. Like my PhD, I like to tell people I'm getting paid for my PhD, which I actually am. Like all my tuition and fees are all paid for by the university, and I actually receive a stipend for living expenses and also just for the work that I produce in the lab. So just even knowing that when you think about a PhD or these higher education degrees, you think about money. Like that's the first thing you think about. But again, there are many opportunities through fellowships, through grants where you can go and pursue these degrees without putting any money out.
and that's the blessing within itself that most folks don't have,
Yes.
that you can go for free. Um,
Mm-hmm.
it does require a lot of work.
It does.
It's not easy. Um, and no PhD is easy, but it's worth it.
It
It's
is.
worth it. We need more
Absolutely.
educators in the space doing the great work, whether it's just doing research or being an educator in academia and becoming a professor. There's just so many different ways that you can go with your PhD.
Mhm.
Um, so I also want to ask you too, like, how do you envision bridging the gap between your scientific work and also real world impact in communities, especially for young underserved mothers who may not have access to clinical research settings?
Yeah, I love this question. I can break it down into like short term like goals and ways I can do that, and then long term. So short term, working with the March of Dimes, they are like boots on the ground, like really in the communities, which I really appreciate. I actually went to one of their events a few weeks ago, or about a month ago. It was a community baby shower where they literally had they rented out an event space. It was really nice. And they provided like gift bags, which had like diapers and wipes and formula, like everything you need that you would get at a normal baby shower, but it was for the community. And so what they did was they even had transportation that was available for these women. So they went into the community, picked these women up, took them to the event. We had a great time. We played games. We had bingo. It was very interactive. There were also community resources there. There was one station like that was specifically on best practices for like sleeping babies and things like that. So um, I think getting involved in these nonprofit organizations, March of Dimes obviously is a very well known organization that really focus on like community building. That was my first event like that, and I was so inspired by it that I'm like, I want to do this, in my hometown. I think a lot of women would benefit from things like that. So, just being in spaces like that where you have people from the community and also community resources and health experts. We had some OBGYNs from Penn who were facilitating the bingo, which was all about best practices during pregnancy and giving birth and once you have your baby, things like that. And so I think that's a really great like short term like option. Just again, just really community based events with healthcare providers, doulas, midwives, things like that. And then long term, I do plan to start up my own like women's health biotech with not only a research arm, but specifically a community outreach and mentorship and just a community sector as well. Like I said, with that three prong approach to health equity is really important for researchers and people in science to be able to disseminate information correctly and impactfully. And so, yeah, that'll be like something I definitely plan to do in the future with the community aspect, really having doulas, which are, maternal caretakers that are from the community, which are super important. And just having health advocates who are Black women or who have these same shared experiences, talking and speaking with and mentoring, especially young underserved mothers. So yeah, those are kind of like short term ways that I can envision this, and then my long term goals.
No, that is amazing, especially wanting to have your own science center.
Yeah.
Really important in leading that really important critical effort for the community because it's not existing.
Yes.
So that's amazing for you wanting to take initiative
Thank you. Yeah.
and hone in on that leadership. So then, like now looking ahead, what gives you hope about the future of reproductive health, and what role do you see for Black women researchers and entrepreneurs in driving that change?
Yeah. What gives me hope about the future of reproductive health is that although the political climate doesn't reflect that or reflect what I'm about to say, there are people and foundations and sponsors and community activists who are fighting for reproductive health and reproductive rights. And so that really gives me hope, especially being at a place like Penn, where it's a private institution, it's predominantly white. I come across more people who support reproductive rights and reproductive health than I don't. which is really hopeful, you know. So there are people not only here at these institutions, but similarly, the March of Dimes is a well-known women's health organization and really at the forefront of improving maternal and infant health outcomes. And they are committed to understanding the disparities that women of color face, how we can end preterm birth, really just focus on supporting what is going on despite the political climate. And then additionally, there are other foundation. I know the Gates Foundation, they have a whole women's health sector. And actually, many biotechs are actually starting to develop their women's health department. So that gives me a lot of hope that we're, you know, my lab and my surrounding friends and lab mates, we're not the only ones working on this. So um, yeah, I think it's we have a hopeful future. There are really great minds and scientists and leaders who support women's health and reproductive health. And so I'm hopeful. Yeah.
No, I think that just hearing all of that, how, your peers that you're working with, leadership that you're working under currently with your PhD, that there is change happening. Sometimes it moves in increments.
Hmm.
Um, you know, every day as you're writing a little bit more with your dissertation, we're getting closer to that change.
Hmm.
So, and that's the hope within it all, that we hope that, we can continue to do this great work. And again, passing the baton
Yes,
to the next generation, because it doesn't stop here. So,
absolutely.
preparing the next generation for leadership roles in this work, not just to be a researcher, but taking on an initiative that can really be the driver of change, because sometimes it's not, uh, being a part of what you may see somebody else doing. You may have to be the one to do it. Uh,
Yeah.
so, like, I
Yeah, I love that.
appreciated your perspective on that. And with that being said, I just want to say thank you so much, Kobe, for being a part of the podcast today, for your wisdom and your service to the community. Um, and conversations like this, it really moves us one step closer to building systems that truly honor, support, and protect mothers of color. So if you're listening and you feel motivated to take action, visit angelsprotectioninc.org to learn more about our projects and programs that we're doing in the community, from mental health outreach, harm reduction, and to also our upcoming projects and programs that we're seeing out for the rest of this year and into the upcoming year for the 2026 year, that we're launching for young women aged 13 to 20. And I also want you guys to remember, silence protects systems, not people. So let's keep breaking it together.
Thank you.